Hello, my name is Jenna Richley, and I will be discussing characteristics of an ideal antimicrobial agent, how antimicrobial agents work, and antibacterial agents. What is an antimicrobial agent? A drug used to treat an infectious disease. What do antimicrobial agents do? Kill or inhibit growth of pathogens, don't cause damage to their host or allergic reactions, can be in solid or liquid form, stay active long enough in the body to be effective, and kill pathogens before they mutate and become resistant. How do antimicrobial agents work? Stop cell wall synthesis, damage cell membranes, stops nucleic acid synthesis, stops protein synthesis, and stops enzyme activity. What is an antibacterial agent? Drugs used to treat bacterial diseases. Examples are fungal diseases use antifungal agents, protozoal diseases use antiprotozoal agents, and viral diseases use antiviral agents. Bacteriostatic drugs inhibit growth of bacteria. Bactericidal drugs kill bacteria. Synergism is when two antimicrobial agents are working together to produce a pathogen killing that is greater than one can achieve alone. Antagonism is when two drugs are working against each other. Synergism is a good thing, and antagonism is a bad thing.
Next up is Jenna Smith going over some other important topics: antifungal agents, antiprotozoal agents, antiviral agents, the two types of drug resistance, how drug resistance occurs. Fungal cells are eukaryotic cells just like our human cells. Antimicrobial drugs are more toxic to our bodies. Antifungal agents work one in three ways. 1. By binding with a cell membrane sterils, by interfering with sterol synthesis, by blocking mitosis or nucleic acid synthesis. Like the fungal cells, protozoa cells are eukaryotic too. This makes it harder to treat using an antimicrobial drug. These agents work by one of two ways. 1. By interfering with DNA and RNA synthesis. 2. Interfering with protozoal metabolism. Antiviral agents are next. These are the newest defenders of antimicrobial agents. These are difficult to develop because viruses are produced within a host cell. There are two types of drug resistance. There's intrinsic resistance and acquired resistance. Below are listed are 4 different reasons why a virus can be drug resistant.
Hi, my name is Andi Pukti, and today I will be covering 4 important topics from Chapter 9. They include strategies in the war against drug resistance, empiric therapy, undesirable effects of antimicrobial agents, and how to use antibiotics. The first strategy in the war against drug resistance is to practice good hygiene. Something as simple as washing our hands helps to control and prevent the spread of diseases. Number 2 strategy, education is crucial. The more we inform our patients, the more they will understand. Number 3 strategy, give a thorough explanation. Explaining to our patients why an antibiotic will not cure a viral infection will reduce the pressure to prescribe one. The last strategy is to prescribe the antibiotic appropriately. At least half of current use of antibiotics are incorrectly prescribed as the wrong drug, wrong dosage, or wrong duration. Next topic is empiric therapy. Empiric therapy is when a doctor must initiate therapy before lab results are available in order to save the patient's life. Determination of diagnosis is made by asking several important questions. Antimicrobial agents have undesirable effects. Prolonged use allows resistant microbes to survive and cause further infection or cause a superinfection by opportunists. They are also toxic and can cause permanent damage to the body. And lastly, the patient can develop allergies that become systematic on the second dosage. One of the most important conversations between a doctor and a patient is how to properly use antibiotics. Always take them as directed and finish them completely, and never save an antibiotic for a rainy day. Misuse of antibiotics can develop other infections or make them worse. Now that we have covered antimicrobial agents, we hope you are able to understand its characteristics, how they work, the different types, how some microbes are able to resist these drugs, the strategies to fight against drug resistance, their undesirable effects, and how to use them properly. Thanks for watching!
created using Powtoon.